In part 2 of the online lecture on substance-related and other addictive disorders, we're going to focus in on the diagnostic criteria. Now, in general, there are 10 classes of substances that are addressed in the DSM-5: alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives and hypnotics, stimulants, tobacco, and then others. However, the three most common types of substance-related disorders we see are related to alcohol, tobacco, and also amphetamines or stimulants. Now, overall, there are two different groups of disorders that are included in the DSM: substance use disorders and substance-induced disorders. And the DSM is laid out so that these two types of disorders are defined for each class of drugs. So there is alcohol use disorder, tobacco use disorder, opioid use disorder, in the same way that there's alcohol-induced disorder and tobacco-induced disorder. Though there is considerable overlap between these different types of disorders, there's also some differences. So what I'm going to do is to show you the diagnostic criteria for these two groups of disorders, and then I'll point out when there are differences across various classes of substances. So to begin, substance use disorders can be diagnosed for all classes of substances except caffeine. In every case, substance use disorders are marked by a cluster of symptoms indicating that the individual continues using the substance despite significant substance-related problems. Overall, the symptoms that people can experience can be categorized into four groups: impaired control, social impairment, risky use, and pharmacological criteria. Impaired control includes symptoms such as when the substance is often taken in larger amounts or over a longer period than was intended. There's a persistent desire or unsuccessful efforts to cut down or control substance use. A great deal of time is spent in activities necessary to obtain, use, or recover from the effects of the substance, or craving, which is a strong desire or urge to use the substance, particularly in settings where the substance was previously obtained or used. Social impairment symptoms, on the other hand, are actually just what they sound like. So recurrent substance use resulting in a failure to fulfill major role obligations at work, at school, or at home. Continued substance use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of the substance, or important social, occupational, or recreational activities that are given up or reduced because of the substance use. Risky use includes recurrent substance use in situations in which it is physically hazardous, and/or substance use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by alcohol or other drugs. And finally, physiological criteria include symptoms of tolerance and/or withdrawal. Tolerance is defined by either of the following: a need for markedly increased amounts of the substance to achieve intoxication or the desired effect, or a markedly diminished effect with continued use of the same amount of the substance. Withdrawal is defined as characteristic withdrawal symptoms for the substance, or if the substance is taken to relieve or avoid withdrawal symptoms. Now, one thing to note is that withdrawal symptoms don't occur for all substances. So for hallucinogens and inhalants, we don't see withdrawal symptoms, even abrupt discontinuation after chronic use. So withdrawal symptoms wouldn't count as a symptom of a substance use disorder for those two classes of substances. Now, with that background in place, we can then move on to the specific diagnostic criteria. What the DSM states is that in order to receive a substance use diagnosis, use of the substance must lead to clinically significant impairment or distress, as manifested by at least two of the previously described symptoms, occurring within a 12-month period. As with many other disorders, we can specify the severity of a substance use disorder as either mild if the person has 2 to 3 symptoms, moderate if the person has 4 to 5 symptoms, or severe if the person has 6 or more symptoms. The next group of disorders in the DSM-5 are substance-induced disorders, and these include substance intoxication, substance withdrawal, and other substance-induced mental disorders, which we're not going to talk about. And depending on the class of substance, the type of substance-induced disorders vary, as do the particular symptoms. Also, an important thing to note is that these are acute diagnostic criteria. So when we say someone is suffering from a substance-induced disorder, we know that we're talking about the immediate effects of a substance or the withdrawal of a substance, rather than some chronic psychiatric condition. So, overall, in order to say someone is suffering from substance intoxication, they must have recently ingested a substance, the consumption of which has caused clinically significant problematic behavioral or psychological changes that developed during or shortly after the ingestion. In addition, the person must demonstrate certain signs or symptoms that develop during or shortly after use, and the signs or symptoms cannot be attributable to another medical condition and are not better explained by another mental disorder, including intoxication with a different substance. So we'll look through some examples of how the DSM describes substance intoxication for 3 different classes of substances: alcohol, cannabis, and stimulants. So for criterion A, recent ingestion of a substance, the diagnoses look the same: recent ingestion or use of the named substance. Criterion B states that clinically significant problematic behavioral or psychological changes have occurred during or shortly after the ingestion. However, the specific problematic behavioral or psychological changes are specified for each class of substance. So for alcohol, criterion B includes as examples inappropriate sexual or aggressive behavior, mood lability or impaired judgment. For cannabis, the examples include impaired motor coordination, euphoria, anxiety, sensation of slowed time, impaired judgment, or social withdrawal. And for stimulants, the examples include euphoria or affective blunting, changes in sociability, hypervigilance, interpersonal sensitivity, anxiety, tension, or anger, stereotype behaviors, or impaired judgment. In addition, each of the separate diagnoses for alcohol intoxication, cannabis intoxication, and stimulant intoxication also specify the particular signs or symptoms that the person must experience. So for alcohol intoxication, this includes one or more of the following: slurred speech, incoordination, unsteady gait, nystagmus, which is involuntary eye movement, impairment in attention or memory, and stupor or coma. To be experiencing cannabis intoxication, the person must have 2 or more of conjunctival injection, which means having red eyes, increased appetite, dry mouth, or tachycardia, which is abnormally rapid heartbeat. Finally, for stimulants, people have to experience 2 or more of tachycardia, pupillary dilation, elevated or lowered blood pressure, perspiration or chills, nausea or vomiting, evidence of weight loss with chronic use, psychomotor agitation or retardation, muscular weakness, respiratory depression, chest pain, or cardiac arrhythmias, and confusion, seizures, dyskinesias, or coma. And for all 3, criterion D is identical. Now, here's the point when I have to insert my own PSA about substance use. What brain imaging work has shown us is the profound and even at times irreversible effects that substances can have on our brains. So what these images are showing is what happens to people's brains after either short or long-term substance use. With tobacco, we see that even after 3 cigarettes, brain activity diminishes significantly. We also see that chronic alcohol use leads to significantly enlarged ventricles, which is extremely problematic. And most scary, however, is the profound effect that inhalants can have on your brain. What we see with chronic inhalant use is the actual reduction in brain mass. So you're literally killing your brain when you do these drugs. So don't do them. Okay, PSA over. Moving along to the second type of substance abuse disorders, which is substance withdrawal. The diagnostic criteria are as follows: cessation of or reduction in substance use that has been heavy and prolonged, symptoms developing within a prescribed time frame following cessation of or reduction in substance use, and the signs or symptoms in criterion B cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So let's look at some examples across 3 different classes of substances: caffeine, tobacco, and opioids. For criterion A, caffeine withdrawal specifies that the person must have been engaging in prolonged daily use of caffeine. For tobacco, it's daily use for at least several weeks, but for opioids, there's no real specific criteria pertaining to previous use. Criterion B looks fairly different across substance classes, however. So for caffeine, the DSM specifies that the person abruptly stopped or reduced their caffeine use, followed within 24 hours by 3 or more of the signs or symptoms, including headache, marked fatigue or drowsiness, dysphoric mood, depressed mood or irritability, difficulty concentrating, or flu-like symptoms. For tobacco withdrawal, abrupt cessation of tobacco use or reduction in the amount of tobacco use must be followed within 24 hours by 4 or more of the following signs or symptoms: irritability, anxiety, difficulty concentrating, increased appetite, restlessness, depressed mood, or insomnia. For opioid withdrawal, the DSM states that within minutes to several days after stopping or reducing heavy or prolonged opioid use, or after administering an opioid antagonist after a period of use, we'll talk about that in a second, the person must experience 3 or more symptoms, including dysphoric mood, nausea or vomiting, muscle aches, lacrimation or rhinorrhea, which is watery eyes or nosebleeds, pupillary dilation or piloerection, which is when your body hair stands up, diarrhea, yawning, fever, or insomnia. And then across all substance classes, criterion C and D are the same, in that the signs or symptoms in criterion B cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, and that the signs or symptoms are not attributable to another medical condition and are not better explained by another mental disorder, including intoxication or withdrawal from another substance. So we'll stop there. In the next segment, we'll touch on treatment for these disorders.